The article today that I'm going to be discussing, it's entitled Motivational Interviewing and Dietary Counseling for Obesity in Primary Care in RTC. The study was a 2-year randomized controlled trial study funded by the U.S. National Institutes of Health and the National Heart, Lung, and Blood Institute. I found this article in the American Academy of Pediatrics journal. The target population, it looked at children from age 2 to 8, and they had to have a BMI in the 85th and the 97th percentile. Exclusions for trials members included having type 1 or type 2 diabetes, non-English speaking parent, non-working phone, chronic medical disorders, chromosomal disorders, syndromes, and non-ambulatory conditions such as cerebral palsy, medications known to affect growth, and they could not be enrolled in a weight loss program or seen by a weight loss specialist within the past 12 months. So the research question that this study looked at was motivational interviewing efficacy in treating pediatric obesity by primary care physicians and by registered dietitians. They did this by looking at 42 pediatric practices, and they were randomly assigned to group 1, 2, or 3. Group 1, they were provided usual care by primary care physicians, and BMI was measured at baseline and at year 1 and at year 2, which was the follow-up year. Group 2, they were provided a primary care physician that conducted motivational interviewing sessions, 4 of those. They were given to parents of overweight children aged 2 to 8. Group 3 was provided primary care physician 4 sessions, but also included 6 sessions of motivational interviewing by an RD. BMI for those 2 groups, they were recorded only at the follow-up year 2. Group 1, there was no extra training. So group 2, primary care physicians were given 2 days of in-person training in motivational interviewing as well as behavior therapy. Group 3 included this training as well, but it was also given to the RDs as well. So the outcomes that were given, they looked at just the BMI percentile at the 2-year follow-up, and that was the only thing that was looked at. Some of the potential limitations that I saw in this were barriers to primary care physician counseling. They have a lack of time and a lack of reimbursement, as well as a lack of counseling skills and the confidence to use those skills and with clients. Those patients, some patients were lost during those 2 years, and so they weren't able to look at their results, and I saw that these were demographics that were prone to being high risk. So you saw low-income minority patients that were lost in the study, and that was something that I saw as a limitation within this. So not all sessions were completed for each group. Only some had all 4 sessions completed. Some only had 2. So that was another limitation I saw, as well as a limitation was the authors indicated in the study that there was no potential conflicts of interest to disclose. So there was nothing that they saw. So I thought maybe that was a little interesting to see. I thought it was very interesting to read this study because we learned about motivational interviewing in our classes, and we don't really look at if it's being effective. There are only a few small-scale studies being done in pediatric obesity with motivational interviewing. This is the first large-scale trial to show significant statistical reductions in BMI being delivered by primary care physicians and RDs. So this is the only one that's been done. There still need to be more research because it's only over 2 years in low doses of motivational interviewing sessions. But there was a significant decrease in mean BMI in both groups 2 and 3 compared to group 1, which was group 1 was the baseline. It was the care given with no motivational interviewing. So my last thoughts on this was that it was very interesting to look at a study that showed the efficacy and the efficiency of motivational interviewing, because we learn about it, we use it, but is it really being effective, and is it working to combat pediatric obesity.